All right, so it is just past 2, so I will get started. Thank you guys so much for joining. My name is Caleigh Paster. I'm a program coordinator here at the dashboard. Today, I will be recording the session, so if you ever want to go back and watch the recording afterwards, I'll be resending it out to anyone that attended today. If you have questions at any time throughout the presentation, feel free to just put those in the chat and I'll get to them after, or I'll do a live Q&A session at the end of the session. The agenda for today looks like I will introduce the dashboard to you all. I'll do a brief site walkthrough so that you get a bit more familiar with the platform. I'll go through a few data examples from our most recent release, and then we'll close it out with a live Q&A session. So without further ado, I'll get started. Can everyone see my screen right now showing the presentation slides? Perfect. Thank you. So we created the dashboard, the Congressional District Health Dashboard, to really get district level data on health and the factors that shape health nationwide, available for everyone, free, easy to use, one-stop resource. So we're really trying to create a nonpartisan resource for anyone interested in this sort of data for their district at the district level. This is the first time that we have ever aggregated this sort of data at the district level on this scale. So we were really excited to create this resource for everyone to use. The goal of creating this unbiased, reliable resource really was to help with priority setting nationwide. Data is a super powerful tool, and while data itself can't change policies necessarily, it is an important ingredient in policy change. So data can help illuminate these challenges and assets in communities that may have otherwise been hidden. Data can inform effective policy solutions. So what might work for one community might not work for another. And finally, data can be used to hold leaders accountable. Like, are you guys living up to the commitments and the responsibilities that we're putting out there? So our audience for this dashboard is really aimed at elected officials and their staff, the advocates, journalists, researchers, medias, and the general public. We created this dashboard with a breadth of experience from the City Health Dashboard, which my team launched back in 2018. That site, it's a sister site to us. It has a lot of very similar metrics on health and the drivers of health, but it is at the city level. So the Congressional District Health Dashboard takes similar metrics and puts it at that district level view. So a different snapshot of the nation. We provide over 35 measures of health and its drivers, and I've listed them out here for you to see. The dashboard data are drawn from federal sources and other data sets that adhere to rigorous standards of data collection and analysis. So that includes some data sources like the US Census Bureau, the Centers for Disease Control and Prevention, or the CDC, the Environmental Protection Agency, or the EPA. So a team here at the dashboard is built up of population health and policy experts, epidemiologists, and geospatial specialists. And we regularly update the dashboard with new year's data, new measures, and relevant policy resources. So we provide you guys with 35 measures on health and its drivers. A lot of these data, as you can see here, represented by the asterisks. We do also provide these data broken down by demographic groups. And for many of these data, we also provide multi-year data as well as data broken down by census tract. So this can be really useful to get this view. So we developed the dashboard in partnership with Robert Wood Johnson Foundation, as well as our bridging partners, the Bipartisan Policy Center and the Center on Budget and Policy Priorities. So these partners really helped us kick the site off, and we're happy to share it with you. So I'll now go into a brief site walkthrough to give you guys a better idea of what's kind of happening here and how you can actually use this site. So if you look here, this is the homepage that you'll find when you get to the Congressional District Health Dashboard site. You'll see here, if you know your district, you can type it in, say New Hampshire first, right there. Or if you don't know your district, you can click on this link here that takes you to a site where you can put in your zip code to find your district. If you go down, we have some relevant news sources, as well as some insights from recent data releases to help you sort of get a better view of who we are what we're doing. The first page that I want to show you is called the district snapshot. So if you click here, I'm currently in New York's 14th, so let's take a look. This page gives you a great snapshot overview of your district and how it's doing. So all of our metrics are listed here in alphabetical order. We have all 35. If you want to know more, say about binge drinking, you can hover over the icon and it will let you know when it was calculated and what sources of data it came from. For this one, it came from the Places Project, which is tied to the CDC. If you click on more about this metric, you'll go to the metric detail page and learn more about it. We can see here on the right that it gives New York's 14th estimate, as well as what that compares to the US average. So sticking with the binge drinking, we see that the New York 14th district estimate is 15.1% of adults report binge drinking in the past 30 days. If we compare that to the US average, which if you hover shows it's 17.1%, we can see it's pretty similar to the average. That's also depicted in picture form in that the average ones will be an orange triangle. If the district has greater than average, it'll be a green circle. And if it's worse than average, it'll be a red square. So this is a really great visual way of just a general overview of your district as you roll down. We also have the functionality to filter by domains. So at the dashboard, we break down our metrics into 5 key domains: health outcomes, social and economic factors, health behavior, physical environment, and clinical care. And these are really great overarching categories that all of our metrics kind of slot into. So for instance, if we wanted to take a look at social and economic factors, we can click here and we can see all of these metrics here listed, again, still alphabetically within those metric domains. Another great feature on the district snapshot is the district facts. Here we can see that the population size of the district, as well as any demographic details, such as the breakdown of age and the race ethnicity. Finally, at the bottom, you can then see who are your representatives in Congress. So we see the representative in the House and the senators, and these are updated as Congress is also updated. So now I'll take you to the next page, which is the metric maps. Today, let's take a look at children in poverty. So we'll click in here, and the first view that you'll see when you click into the metric maps for any given metric is the national view. So this will show you the whole nation. We also have Alaska as well as Hawaii over here. And so this is color-coded according to these values above. So right here, it says that the US national average is 16.1%. And that shows that this color is around 16.1%. So all of the states that have, or the districts that have that average will be color-coded that way. Lower values, or the lighter colors, will be the better values for this metric, and then the deeper colors will be those that are doing worse than the average. We see that right now we're looking at 2021. You're also able to toggle on the left to a different year, so look at 2020. So this is a great way to kind of see across the years, how are your districts doing, how is the country doing for this particular metric. Say if we wanted to dive in a little deeper, you're able to zoom in here manually to see a better view of certain districts, or you can go up here and see the state level view. So say with New York, we can go here and see New York's values, or if you want to dive in a bit deeper, you can dive in to see. When you click on a district, it will then show you that district's average, and you can view a little closer here. Next, let's go back to New York's 14th, and we can see that this shows the whole district. On average, the 14th district is doing worse than the US average. We're also now able to toggle between not only the US average, but also the state value. So we can see how it's doing compared to New York. It's relatively similar here for this year. A new function that we added recently is that we can now take an even more granular look at this data by showing census tracts within a district. So the district overall, we can see this view here. If you click on the left, show census tracts, it's now broken down. We can see that a large part of this district is actually made up of a lot of waterways, an airport, a big part, and those parts do not count towards this district average, but we can see that there is a large variation within this district for this metric. So for instance, this census tract has 11.5 versus this one over here has 71.2%. binge drinking. So variations across the districts give you a better insight into how your district is doing and comparing it to different neighborhoods. So that is the metric maps. You can also navigate backwards at the top here if you want to go back to the state of New York or back to the US average for this particular measure. Next, we can look at metric by demographic. I'll once again stick with New York's 14th for today. We'll go in and let's stick with children in poverty to see what the demographic details are for this measure in this district. If we go down, we see that it shows us the breakdown by racial ethnic groups, and we can see who has the highest, who has the lowest, while also seeing that comparator of 23.8, which we were again seeing in the metric maps compared to the US average. So now we can see how does that actually break down between demographic groups. And again, we can toggle on the left between different years and see how does that change for groups across the years. If you want more detail about children in poverty, you can see a little bit of information here, but if you go to metric details, this gives you a good overview of all the metrics that we have on the page. Again, we can click in and see a little bit more detail. We can see the US average, but it will also break it down by what is this metric actually measuring, what are some strengths, what are some limitations, and how is it calculated. So for those that are a bit more curious about certain ones, this is how we're really able to show you how are we breaking these down, and how is this a reliable source, and how do you explain this to other people as you're using this data to help push your policies forward. So that's a good overview of what the dashboard has, how you can kind of navigate through and see different features and compare across years. The last thing that I would like to show you is that all of our data on the site is available for free download and access. So if you just go on the top right to the menu and click access the data, you're taken to this page. Here, if you're using it for research purposes, it does give you a nice citation of how to cite the dashboard in your research. But we also provide here a code book and a technical documentation that really shows you, how are we coding for this data and what are some specific nuances for particular data sets. FAQs are here as well. In case you have a question, you can go here first, or of course, you're always welcome to email or contact us and we'll get on those questions right away. Down here, you're able to download all of the data on the site, either for all congressional districts, which is a bigger file, or you can go in and do it state by state to really narrow in to where is most relevant for you and your work. So that is the dashboard. And now we can take a look at sort of what can you do with all this data, because there's a lot on the site and it's kind of a lot to look at and really take in at first. So we're going to spotlight some of the data. We launched in January of this year, and most recently we had actually a data update in June. In that data update, as I previously said, we now have census tract level data for 24 metrics. We have new years of data for 22 metrics. And then we also have improved some of those filtering features on the metrics overview and metrics maps page. So we're always kind of innovating and hearing what user feedback is so we can make sure our site is as up to date as possibly can be. So with some of those updates, we were able to do a bit more deep dive into the actual data. So the first little insight I'd like to look at is uninsurance. So healthcare access is always a big topic, especially at the federal level, and looking at what we can do about that. And so this measure that we have on the site for uninsurance, it is a measure of how many individuals are without healthcare coverage at the time. And so we compared across the year 2020 to 2021 to find which districts had the greatest increase of individuals that now lacked health insurance versus those who decreased those levels. And we can see those top 5 districts of the biggest increases in uninsured rates and biggest decreases here. We saw that Texas's 2nd district had the largest increase in uninsured residents between these years at 11.5%, while in New York's 17th district, there was the largest decrease in uninsured individuals at 9.6%. So this is a really interesting way to look at data across districts across the nation. Next, I will just show you a little snapshot of broadband, and this really goes to show the usability and and great ways that you can use the census tract data to look even deeper into districts. So we looked in 2021 at broadband connection, which is your ability to connect to stable Wi-Fi and internet. And we saw that Virginia's 11th district, which is a suburban district in Northern Virginia, has the most connected district in the whole country in 2021 at 91% broadband connection. But then when we actually look into those census tracts, we see that there is a 74 percentage point gap between the most connected census tract in that district versus the least connected census tract in that district. So the least connected only had 26% connection versus the highest had 100%. So you can see, what policies do you have in this district and how can you kind of help raise this? And even though it looks like, yes, this district has a lot of broadband connection, there are still discrepancies that exist at the more granular level. So I hope those two examples gave you a nice little overview of what you can start doing with this data and how you can use it for your policies. And so that's the end of my walkthrough. Of course, you're always welcome to stay in touch with us. We have Twitter, or X as they call it now, at CD Health Data. We're always posting there and keeping you relevant. You're also more than welcome to subscribe. We have a newsletter that goes out every other month, kind of keeping you in the know of the latest updates, any data insights. And then we're always available to help with questions, to do one-on-one walkthroughs, to kind of give you a rundown like I just did in this virtual office hours for any of your constituents, and just reach out to us at our email for any questions about that. So that was a lot of talking from me. So now I will open it up to any questions. Feel free to take yourself off mute and ask live, or just pop any questions that you have right into the chat. So I see we had a question in the chat about census level data. And yes, you're able to now go into for 22 metrics. You can go down to that census tract level to see an even more granular view of those points. That's really cool, Melissa. I'm glad to hear that you're using this sort of data for your work. And we definitely have a ton of social determinants of health on the site. As I said before, you're able to filter by the domains. And so you can always filter by those and kind of see which metrics might be the best to match up.
Thank you. Yeah, it's just extremely timely. I am literally working on this right before and after this, working my way through some of those things. So, yeah,
that's amazing. And yeah, I'm so excited to hear that you found the site. Can I ask do you have a particular area that you're interested in or district?
North Carolina, we are working on our grant as far as identifying those who are at the highest risk and have the most need for interventions for stroke.
No, that's amazing. Yeah, so we definitely have a lot of data for that. I'm excited to hear that you're using it. And yeah,
I'm digging deep between age, income, high school, making it down, to filtering it down to what counties, how many census tracts, the impact and everything like that. So yeah, this is very good as another resource for me. Once we're done, I'm going to dig right into it and explore it some, see what I can get.
I'm
Yeah,
excited to
it's a
hear
big-
that. And if you want ever any one-on-one walkthrough or anything like that, just feel free to reach out to us. We're happy to do that for you so that your whole team can kind of be really in the weeds with this data that we provide.
I appreciate that. Thanks.
If anyone has any questions, again, feel free to pop them in the chat or just take yourself off mute and ask. I'll be here for the time, but if not, thank you guys so much for joining. And again, feel free to reach out. This whole session was recorded, so I will be sending it around for those of you who want to watch it again. But yeah, I'm here for the whole hour, so if anyone has any questions or wants more of a walkthrough, just let me know. Hi, for those of you who are just joining us, we did seem to ramp a little quickly, but I'm happy to go through the presentation again if you want a walkthrough of the site, if you want a little overview of who we are here at the dashboard, let me know. I'm happy to run through it to get you better acquainted with the dashboard and everything we have. Great. So for those of you who have already been on for the presentation, I'm just gonna go run through it again. I'm gonna so feel free to pop off, but I'll start from the beginning. So hi, nice to meet you, Whitney, and welcome. If you want to share what district or organization you're associated with, I'd love to hear kind of where you're coming from. And if there's any particular data you're interested in, I'm also happy to kind of dive in there and take a look for you during my walkthrough. But so I'll go ahead with my presentation now. So my name is Caleigh and I'm the program coordinator here at the dashboard. This session is recorded, so it will be shared with you afterwards. And if you have any questions, just pop them in the chat. A few of my coworkers are in the chat and are monitoring, and otherwise I'm also happy to answer them live as we kind of go through all of this for you. So we really created the dashboard to help have this resource so that people could have this congressional district level data available, reliable, and ready to use at any time. Data itself can't really change policies, but it's a huge tool for helping create policy change. It illuminates challenges that might have been hidden before. It can inform effective policy solutions. What might work in one community might not work in the other, and it can really help hold leaders accountable as well to their commitments and their responsibilities. We're using this dashboard to really target anyone that's working within these elected officials positions and at the federal level, and anyone else that's kind of an advocate for those. We have a sister site called the City Health Dashboard that we launched in 2018, and we really built off of those experiences to build out this dashboard to target more nationwide efforts and federal efforts as opposed to the city level efforts that site supports. And so this site here, we have 35 measures on health and the factors that drive health. They're taken from reliable federal data sets from across the country. We use a lot of data from the US Census Bureau, the Centers for Disease Control and Prevention, the Environmental Protection Agency, among others. The team here at the dashboard is made up of population health and policy experts, epidemiologists, geospatial specialists, and we are constantly updating this dashboard to make sure it's as relevant as possible. So we put new years of data, new measures, relevant policy resources for all the metrics on the site. So we do have these 35 measures that are listed out here, those with asterisks. We provide demographic breakdowns, and then we also, for many of our measures, provide multi-year data as well as data that is broken down by census tract. So you're able to get even more granular level data as you go through it. We created the resource with the help from our bridging partners and the Robert Wood Johnson Foundation. So I'll now kind of dive into the site, and I can target my walkthrough with the Florida 25th district in mind, just to help you kind of get an idea of how you can use the site. So if we go here to the main page of the dashboard, you can type in your district here if you know it, and that'll just take you right to the page. But I just want to show you around a bit more. You can read more about the dashboard here, as well as any high level highlights from either news articles or other release highlights or research that we've done. That'll appear here, which can give you a better idea of like the things that we're doing here at the dashboard. To start, we'll do the district snapshot. I'll go to Florida's 25th. And here we can see this will list all 35 metrics here. And this is just a snapshot overview of how your district is doing. And so we can see here all of the metrics that we have are listed alphabetically. You can scroll down and see on the right, you can see how is your district doing based on the average that your district is, which is this number here. So for instance, binge drinking in Florida's 25th, we have 14.9% of adults report binge drinking the past 30 days, according to this survey. That's around average. And you can hover here for the US average, which is 17.1. If you want more information on this metric, you can hover over it and it'll tell you what year it was calculated from, as well as the sources of data. If you click into this, it'll take you to the metric detail page, which will give you a bit more information as to, you know, how did we calculate this? What does this measure really mean? And other information about the measure. We categorize all of our metrics into different metric domains. So we have 5 different domains, which are health outcomes, social and economic factors, health behavior, physical environment, and clinical care. And those are the overarching categories that all of these measures kind of fit into. And we felt that those were some of the biggest influencers of health and health outcomes. So for instance, you can sort by social and economic factors here, and then all of the measures shown still alphabetically will only be those that are within this domain. On the right, we see that those orange triangles mean that just right off the bat, visually, you can tell that your district for that measure is around average. If you see this green circle, it means you're doing better than average. And then it looks like there's all the way down here, we have this one measure that's doing worse than average. So this does give you a nice little overview of how is your district doing compared to the US overall. What are some good areas to kind of target, and what are other areas where you're really doing well in, to see what does that translate to in policy. Another neat fact about this district snapshot is that you can look at district facts. This gives you a breakdown of age for your district, as well as racial ethnic breakdown, which helps you understand a bit more like what is the makeup of your particular district. If you go down even further, you can then see who are your representatives, more information about them, places to contact them. And this is updated as Congress has updated itself, so you can always know that what's there is going to be the most up to date. So we can go to metric maps now, and maybe we will focus on high school completion, and we can take a look. If we do metric maps, it'll show you right off the bat the whole nationwide view. So this is nationwide. You can see Alaska as well as Hawaii over here in the ocean, and the rest of it is continental US. We'll focus on continental US right now, and you can zoom in or out as you please to see how the different districts are made up. So this is a really great way to get a nationwide view. And then you can also see down here, if you want to say focus on Florida, you can then type in Florida and look at a state level view for this measure. Up top, it'll give you a sense-making statement to understand, you know, what is this map saying? What am I trying to learn from this? So right now it says in Florida, 89% of adults have a high school diploma or equivalent in 2021, compared to the national average of 88.6. So in this case, Florida is doing slightly better than the national average. This is for 2021. If you'd like to, you can toggle to different years. So for this metric, we have 2021 and 2020. So this is a great way to kind of compare across years. Once the map loads, you'll be able to see kind of those comparisons between years for different districts. So if you want to dive in even deeper, you can then go to the 25th district, and that'll just give you the overview here for this district. If you want to see it broken down even more, say you see that you're doing, better than average for this metric compared to the US, maybe you want to see how's my district doing compared to Florida instead, you can toggle on the left here. You can see how's it doing to Florida. This now gives you, instead of the US average, it'll give you Florida's state average. You can then also break down by census tract. So this gives you an even better view of, okay, my district overall is doing better, but how are the individual parts of the district doing? So you can see there is some variation here. These ones are doing 69% high school completion compared to some neighboring census tracts, which say have 94%. So this is a great way to kind of see even more granular level, how is your district doing? On the left, we also have some tips and cautions for using the data as you go through it. And then you're very easily able to change your metric here to say, choose another metric of interest. If you want to navigate back at all, you're also able to just kind of hop back up here at the left to have an easy way to toggle between these map views. Next, we have the metrics by demographic. So again, let's do Florida 25th. We'll zoom in, we'll stick with high school completion. And now this gives you a breakdown by demographic details for this particular measure. So now we're looking at 2021 for high school completion in Florida's 25th. We can see the makeup of, who makes up this graduating class. We can see it's pretty evenly male and female. And then if we go down, we see, who's graduating among different racial and ethnic breakdowns. So this is a really great way to see if there's a particular demographic group that is maybe struggling more or succeeding more than others, and seeing how to really focus your policy efforts as you go through it. Then if you wanted to learn a bit more about particular metrics and how it's measured, like I said before, you can find this anytime you kind of click on that measure and on any of those previous pages, or very easily up here on metrics background. Say you want to learn more about high school completion. How is it calculated? What does this metric actually mean? You can click in here and you can see, how did we calculate it? What is the original source? What is the US average? And then a little bit more on the strengths and limitations of this, and even deeper level, how's it calculated? What are the references and all of that? So we try to be really transparent here so that you're able to dive in and really see how reliable this resource is. And then the last thing I want to show is that all of the data available on the site is free and easy to access for anyone. So if you just click on the about and then the access the data, you can see if you're researching, how to cite it, or if you have more information, or you want more information on how we calculate these data or the technical documentation, so the nuances and particular data sets, you can click on these. Those will give you your information. But if you just want to download the data, it's all right here. All the congressional districts are available for download, or if, for instance, you're just interested in Florida, you can find Florida's right here. You can just download the Florida package and that'll give you all the data. If you have questions or want specific walkthroughs for any of this data, you can always contact us here and we're happy to do one of these demos for your team so that you can get a better idea of what's going on in your district and how to really interpret it all. So that's a brief walkthrough. I have a few examples of kind of how we've used the data as well. We launched our site in January of this year and just updated it in June. And in that update, we were able to add the census level breakdowns, which I showed. So for 24 metrics, we're able to break down by census tract. And then for 22 of our metrics, we added a new year of data. So you can really do that multi-year comparison. And then we also improved some of our features. So we're always listening to user feedback and trying to see how can we best improve the site so that the people who are using it can get the most use out of it. And so it's easy for everyone. And so we improved some of those sorts of things. And we took a look at a few of these new updates with our data at the current data release. And we saw for one of them, we looked across years to see, how can you use the data to really get some information between years. And we looked at uninsurance rates, which is how many individuals are lacking health insurance. And we saw that Texas's second district had the greatest increase in uninsured individuals in their district from 2020 to 2021 at 11.5%, compared to New York's 17th district that had the biggest decrease in uninsurance rates. So this is a really interesting way to kind of see across years, across districts, what does that new year of data really tell you, and how might that relate to any policies? And then finally, we also looked at broadband access. So that's, information on Wi-Fi accessibility and internet access. And we were able to see that in 2021, Virginia's 11th district, which is a suburban district in Northern Virginia, it had the highest broadband connection compared to all of the districts in the country. But then when you're able to look at that census tract level data, you are able to really see that there's actually still some discrepancies that exist within that district. So there's actually a 74 percentage point gap between the census tract in that district that has the most connection versus the tract that has the least connection. So that's an interesting kind of point that you're able to see with this update to the site that you can dive even deeper into. So that's kind of my rundown. Yes, I want to welcome Ebony. Thanks for joining us today. I just went through a quick walk through the site, but happy to go through it again if you have any areas that are of particular interest. But yeah, so that's the walkthrough. If you have any questions, just feel free to take yourself off mute. I'm happy to run through other things again, or you can just pop them in the chat, and we'll get to them. So thank you guys.
Thank you. I think I missed your pronunciation of your first name. Is it Caleigh?
Yeah, it's Caleigh.
Okay, great. I just wanted to say thank you so much. I'm a community psychologist, and this would have been very helpful for me when I was doing research and stuff for my capstone project. But now that I'm working at this capacity, I could certainly utilize this tool later on in my content memos and stuff. So thank you so much. This was very extensive and nice and bite-sized information for me. Thank you.
Yeah, thanks for joining, and happy to hear it's a resource that you can now use. So excited to see how you use it. Hi, and I see there's some more people that are joining. I know I just kind of finished up, but we still have some time if anyone wants me to sort of run through the site again. If you have any particular areas of interest, I'm happy to use this time to show you guys the site. It's a pretty small group today, so if you have particular areas of interest or questions, just let me know. Feel free to just take yourself off mute if you have a question.
Hi there, my name is Omar Martinez Gonzalez. I use he, him, his pronouns, and I'm over at the AIDS Foundation Chicago. I'm so sorry if I'm mispronouncing your name, Caleigh?
Caleigh, but nice to meet you, all right.
Caleigh, nice to meet you. Apologies for coming in late. I was
All
stuck in
good.
another meeting. I'm just curious to know how this resource maybe takes into account data that impacts people living with or vulnerable to HIV. This is a resource that was shared with me by another colleague because I spearhead AFC's federal advocacy work. And I believe I did some, a quick dive through the dashboard. I didn't immediately see anything on HIV. So I was curious to know if you can provide any insight around that.
Yeah, so none of our metrics specifically target or look at HIV. But if you can see here, I'll pull up a slide of our metrics that we have on the site. Oh my gosh, sorry. So here are all the metrics that we have on the site. We have 35 different measures on health and its drivers. And while none of them are specifically targeting HIV, there are really good ways to kind of see different factors that might affect HIV. So I'm not sure if you have particular data already. And you said you were in the Chicago area. If you have those data points already, you can kind of put them in comparison with some of our data and see, how might some social and economic factors be affecting individuals. And if you want other sorts of information, you can look at, for instance, something that comes to mind might be, routine checkups. Are people getting checked regularly for these sorts of diseases? And you can see that here on our site. We have some measures that touch on that. We have a few other health outcome measures as well that might be kind of relevant to that area of research. And so we are able to dive into some of those other metrics on our site, but that is definitely an area of interest. And we're always, trying to expand and think about what other measures might be of interest to individuals and users of the site. But yeah, so our site gives you a nice way to kind of look at different health outcomes, factors, things that affect health. And you can download the data and use that in comparison to any other data that you have. Our data on the site is broken down by district, congressional district level. So you can look at districts, or you can go in even more. And you can look at the census tract level within a district. So you can get some really granular data here on our site in all of these 35 measures. And if you want, I can also go in and kind of show you a bit more what that would look like for any of these measures that might be of interest to you.
No, this is great. Thank you. And yeah, I mean, HIV exists as a syndemic with other health outcomes, health issues. And so that's something that we definitely pay attention to. Right off the bat, like opioid overdose deaths would definitely be tied to HIV to some capacity.
Oh, yeah.
We're also thinking about housing and stuff like that. So I appreciate it.
Yeah, no, a lot of these definitely have overlap. And that's why we we have 35 measures on here. We're always thinking about more that we want to add, but these were a great way for us to kind of see, a lot of these have things in common with certain health outcomes, factors that affect health. So we definitely tried to have a nice overarching range between those certain categories. Yeah, so I see a few questions in the chat. Feel free to also take yourself off mute if you have a question, but I'm just going to go through some of these here. So it looks like someone downloaded the data and they saw that the congressional district file can filter by race and gender, but the census tract level, they only see the total. So that's correct. So we showed district level breakdowns by demographic for any of these here that show this asterisk. So those ones we show district level totals, but when we do census tract level, we're only really showing the information for that particular metric. We didn't have that information to provide at the census tract level for certain measures. And yes, I just saw that someone asked if they could show census tract level. So I'll just do a quick demo. So maybe I'll take a look at opioid overdose deaths. So if we go on the site here, if you go to the homepage, you can type in whatever district you are interested in. So maybe today I will go to, let's go to one in Illinois, maybe the third. So if we go here, if you go to Metro, this will just show you an overview of the district overall, but we want to look at in particular metric by demographics. So we can go to one in Illinois, say the 4th, and we want to look at opioid overdose deaths. So if you click here, then you can see the breakdown by demographics. So here we see that it shows a breakdown for this area in female versus male. So who is experiencing these opioid overdose deaths? We see that there is a little discrepancy between the sexes. And then if you go down, you're also able to see a breakdown by racial ethnic groups. And so we can see how is this kind of being broken down and split up between groups. Are there certain groups that might need more resources or policy efforts? And so this is a great way to kind of see an overview here. And there's a lot happening in the chat, so let me just check back in. Yes, agreed. It would be a fantastic resource to have on the site, so we're definitely taking that down. And as I said before, we're always looking to update the site and make sure it's most up-to-date as it can be with sorts of metrics and considering user feedback. So we'll definitely make sure to take a look at that and see what data sources are out there and if that's a possibility for us on the site. I am just going to post in the chat here our information to contact us that I put on the last page in case anyone is interested in reaching out. So feel free to send us an email here. I do, personalized walkthroughs for organizations, for individuals, for anyone kind of interested. And then also our social, we're on Twitter at CD Health Data for those interested. We have a nice social presence and you're always able to, engage with us there. And then also you're more than welcome to subscribe to our newsletter, which provides, pretty regular updates on what's happening on the site, a quick little data snapshot, as well as just information on, where we in the news, how are we featured, as well as like any feedback that you guys have for us. Dashboard. So I'll put that here in the chat. Happy to hear you subscribed. And about fact sheets. So on the site, you're able, I'll just go back to the site really quickly. On the site, you're able to access all of the data that we have here. So you're able to download it, use it as you would like. If you're doing research, if you're using it in policy, whatever that may be, you're able to cite us here. We don't have the, if I'm correct, and I know my colleague, Catherine, is asking for a bit more detail on what you're looking for, but my interpretation from what I'm interpreting, I don't think we can actually create those fact sheets just straight from the site, but you're able to use all of our data to create those fact sheets on your own to really look at individually what you're looking for. Obviously, you're more than welcome to use kind of the figures on our site. So if you wanted to, again, I'll just look at opioid death. If you wanted to look at, this measure across the US, you can kind of take these images and use them as you'd like, citing us there. And then also we ourselves have created some fact sheets in the past that kind of look at what is our research team looking at, how did we use the data on the site. One of those is here. So in June this year, we had an update to the site to really show, to showcase kind of what we're doing with that update. Actually, this isn't the one I was looking for, but I believe it's June, the findings fact sheet. So we created a fact sheet here just for kind of our use of showcasing, how can you use this information and are these updates relevant to work being done? And so in this fact sheet, we dove into a few of the particular measures given updates, like looking at multi-years of data or census tracts, and we dove into those a bit more in detail here. And so these come with some graphics where you can really dive into, say, children in poverty rates, the differences between years, or uninsurance rates. We created this using all of this, just using our data that's readily available on the site, free to download. You can see we, made this map where you can compare between rent burden across years and information like that. And so all of these are readily able to be created using all the data on the site, like I said, and it's easy and accessible for download. Yeah, any other questions? Feel free to take yourself off mute. If you want me to walk through any particular part of the site, I'm happy to. Just let me know.
This is Omar again. I'll come off mute to kind of address Catherine's question, and you basically answered my question, whether or not the site could generate like fact sheets. I think what's of interest to us would be if, like, especially as we do advocacy with specific congressional offices, we focus mostly on Illinois. It would be cool to pull like a fact sheet that talks about the district. Obviously, you mentioned there's not something specific to HIV, but even a general fact sheet about healthcare or like health outcomes within the district would be very useful to us. And maybe if it was able to generate like specific, like the most outstanding or like glaring health issues in each congressional district, that would be useful. We definitely can pull the information and create our own fact sheets, but it's just I'm thinking in terms of capacity, especially like smaller orgs that may want to use this.
Right.
They may not have the capacity to do that. So I was curious about that. You did mention using the I guess the graphics or the pictures. Is that something that's downloadable, or is it just more like a screenshot and then?
Yeah, so two things. So I'll address that in 1 second because I have this top of mind. But I think something else that might be of interest to you, and I'm not sure if I already kind of walked through this while you were on the call, but we do have district snapshots. And so while this isn't necessarily a look at, for instance, Illinois as a whole for the state, you can look into each district. And what this page does show you is kind of that overview of, what metrics are doing better, what metrics are doing worse for each district, which might be kind of up the alley of what you're looking for. And this does give a bit more of a visual where if there's this green circle, it means it's doing better than average. This red square, it means it's doing worse than average, or this triangle. And then all of these, if you kind of hover, it shows you the US average. In the middle, it shows you, how it's doing. And then on the left, it shows you what kind of category this falls into in terms of, is it a health outcome, a health behavior, or whatever domain it is. There's also more information here on the source that it came from, but I think this is a really nice visual way to kind of see for specific districts. So for instance, if you're interested in Illinois, you can look at all those Illinois districts and kind of see how does that compare. I definitely hear you on the capacity part. It would be very useful and great if we had that capacity on our site, and we're definitely going to note it down because that's a fantastic idea. But yeah, in terms of actual, let's look at, I don't know, diabetes in Illinois. So you're able to look at the state level on the site as well. So you could look at the state
Oh,
level.
that's beautiful.
Yeah, so I love.
Oh, I'm off mute. Sorry.
You're able to zoom in as well. So if you want, I know around the Chicago area, there's a ton of districts that are pretty tiny. So you can make sure you zoom into to kind of see this. And then this color scheme is broken down for you based on, how well that particular district is doing compared to the US average. You can toggle years here. So this is also a nice way, a nice visual of, for instance, states or other sorts of things. These particular images are not available for download on the site, but screenshots always always easy, great way to get them. And also if you have a particular request for any image on the site, feel free to reach out to us and we can send that over to you in a different format if that is easier. But yeah, we're always available on email or whatever it is to help you with these sorts of needs. But yeah, I hope that kind of helps address any of those questions, and always appreciate the feedback, especially the uncensored off mute ones. Any other questions? I know we have a few minutes left here, so I'm happy to stay on or keep diving into particular areas if you're interested and want more of a walkthrough. Thanks. And if no one else has other questions, feel free to hop off. Otherwise, stay on. I'll be here up until 3 o'clock to answer any questions, to walk through more data, any of your Congressional District Health Dashboard needs. Thanks for joining, guys.